So we're continuing on with our point of care echo course. Okay, we're going to look at the basics here. So what I want to discuss here are the transducer and some of the exam preparation things. So we'll look at those here. Now the transducer we use, and this is the one that helps us image what we're going to do, is a phased array and often has a frequency between 1 and 5 million hertz, okay, in adults. Now it could be up to 10 hertz, and that's with different frequency transducers, but the one that we have, or what we use, it tends to be between 1 and 5 million hertz, okay, and this is the transducer right here, okay, this one here. So that's what we're talking about here, and this is pretty much the instrument that we use and hold when we're doing the point of care echo. Now the orientation marker, which is this dot here, okay, helps us and corresponds to the orientation of the ultrasound on the monitor. Okay, so here, imagine this is your image here, your 2D image, and here's the marker, okay, this one in yellow. So this orientation marker, okay, helps you to know what side of the screen you're working with, or which side to orient yourself to the patient, okay? And it's very helpful as we look at windows in upcoming lectures where the transducer is pointed. So if you look at this image here, notice that this is the orientation marker, and it's pointed in this direction, okay? And that is very helpful when we start looking at different windows of the heart and different views, and how we tilt and are able to capture different areas of the heart. Now, it's often in the right upper screen that you'll see that transducer marker, and placement and manipulation is key for optimization of the transducer, okay? And this will differ with each patient. Some patients maybe have more adipose tissue or are obese, which will make it more difficult. The heart position obviously makes it difficult as well. People with long-standing lung disease may make it a little more challenging. We're still able to often get them, okay? And small changes with the transducer, so if you're holding this transducer here, and any small change can have a significant impact on the image quality, okay? If you have already done this, you're probably already well aware of that. Now we use this ultrasound gel, so let me just erase some of this here, okay? So we talked about the orientation marker, helps us to orient us where we are on the screen, and is helpful when we look at different windows. And here's the ultrasound gel, and this serves as a medium to allow optimal conduction between the skin and the transducer, okay? The transducer emits these sound waves, okay, that go out, and then they're reflected back. And in order to optimize the image quality, we use this, okay? And this helps the conduction between the transducer and the structure that we're analyzing much better. So the gel is very important, okay? And when you get to a thin layer on the patient, you tend to want to apply more. Now there's adjustments that we can do with the transducer that you may be aware of, okay? And this has to do with aligning or placing the transducer with the anatomy structure, okay? So where we actually align it, we can rotate the transducer, whether clockwise or counterclockwise, to change different views and optimize the image. And we can tilt the transducer, okay? And so within certain windows, there's different views that we'll learn about, okay? And we can tilt it up or down, side to side movements. These change the views. They help us identify various aspects of the anatomy, give us more sometimes atypical views that are outside of your standard views, and help us to optimize the image, okay? Not all patients are the same, and so being able to really be able to use these different skills helps you to identify anatomy much better, okay? And really you have to remember that echo is certainly operator dependent, meaning it depends on the sonographer's skill level, okay? So training is very important, and just being able to familiarize and be able to use the equipment is important as well, okay? Now exam preparation, positioning is very important, okay? Again, this is point of care. We're not doing transthoracic echo in a full exam or a transesophageal. This is a point of care echo. Someone comes in, we have to do something, or we're doing more serial exams at bedside. So patient position, we often want them supine or lying flat if possible. The left lateral decubitus position, when they're on their left side, helps to shift the heart laterally closer to the chest and makes it often easier. If they raise their left arm over the head, this helps to spread out the intercostal spaces and gives us more windows. So windows, if you imagine a rib and a rib here, a window would be an area between them that we can kind of look through to identify and see the heart, okay? Obviously, you love my heart diagram, okay? So you can look through that, and that's pretty much where we're placing the transducer in these different areas to go between them to give us a view of the heart, okay? So patient comfort is very key, okay? Sometimes these exams aren't often that long, but if you're doing a longer exam, you know, you want to make sure they're comfortable because, you know, any movement really can disrupt and make you have to start over again. So for the sonographer, the operator that is doing the exam, you want to stand level to the patient's shoulders. Make sure you're comfortable as well. Okay, you can adjust the height of the bed, and you want to scan with the left or right hand. Use the hand that's, you know, you're often going to use moving forward. That way you can just, you know, this is a skill that you want to keep learning and working on. So try to stick with one hand. Again, you're applying the gel, so positioning, applying the gel, locating the ultrasound window, meaning that area that we're going to go look at, and we'll look at different windows in upcoming lectures and views, so don't worry about that. And then adjusting the transducer as we discussed here, okay, different adjustments we can do. So that's what I wanted to discuss here. Let's review what we discussed before we end, and then I'll leave you with this. So the transducer, again, often a phased array, often between 1 and 5 million hertz in adult patients we use. The orientation marker helps us to orient us not only to anatomy of the heart, but also to the image. Remember, there's that often in the right upper screen, you'll see that orientation marker that helps you identify. So imagine this is the right, and this would be the right as well. Now, placement and manipulation of the transducer is very key to optimize the image. We want to use the gel to have good conduction between the skin and the transducer. There's a number of adjustments you can do. So if you have a transducer or you have a machine, it's very helpful. You want to make sure you're working on the skill over and over again. Exam prep, we talked about positioning, applying the gel, locating the windows that we'll go through in upcoming lectures, and adjusting transducer. Okay, so those are the main things. Again, this is point of care echo, something you're going to do quickly at bedside or more of a serial image, maybe on rounds daily to see if maybe an effusion's decreasing or, you know, assess heart failure patients. Well, that's all I have for today and in this lecture. I hope you learned something. Now, just to keep you in mind of our course material that we have available, so again, if you go to our website, www.ekg.md, okay, so this is our website, and what you'll notice is that if you go to the EKG course here, okay, you'll find stuff that's separate. So notice that we have a number of topics, practice material, lectures, a way for you to contribute, and this is the course here over here. So you'll notice we have over 300 videos or so, and that's more on YouTube. There's another 100, more than 100, about 200 videos that are available with the course. So those are separate videos, and this course is really designed to take you from a beginner to advanced interpreter. Okay, so completely separate from what you're getting online for free. Okay, these are course material that comes with it. So notice that you have a book. Okay, and then you also have the pocket guide available, so you can choose which format. They are the same thing, both these book and the pocket guide, different formats. I really like this small one because you can keep it in your white coat if you're in the clinic or in your pocket, and it's really available on the go. Now with the book, you also get videos. So notice these are the videos, okay? And these are a video for every single page in that book. So it's over 30 hours of video. Now there's a number of practice material that I continue to upload there. Okay, we'll have practice questions coming soon. So all of that's available. Again, this is separate from all the free material that you get already. Okay, so this is more high yield stuff. This is what we used to teach our technicians here and our students here at Mayo Clinic. and it's used now among many institutions. So check that out. Now, what it also includes are calipers. So yes, you get calipers with this course. Okay. I don't know anyone else that offers that, but you do get calipers. I think they're very helpful, and they can, if you know how to use them correctly, can help to identify different arrhythmias that are going on. Okay. And then you also get our pocket EKG reference. Okay, this was something we've put together as we were developing course for the fellows, and this is really nice. It has every code, as you saw earlier, laid out there. Very small pocket guide available. I had help with my colleague, Dr. Peter Noseworthy, who's the head of the EKG lab here at Mayo Clinic, in editing it. So this is something that we use, and we found very helpful. So go to the EKG course. You'll see examples of lectures, okay, why we developed this, okay. A lot of it came about from myself struggling with learning EKGs, having a father that was an interventional cardiologist, and, still struggling. So my struggle is a struggle that I don't want you to have in learning them, okay. You can read all those introductory books, but honestly, they are not enough, okay, and you find yourself using other resources, which is part of the learning process. I wanted to expedite that process for you and make it less inefficient in pretty much what I struggled with going and learning through EKG. So again, from beginner to advanced level with this course, you get the book, the calipers, the coding reference, video access, okay, and now we're offering 25% off. 25% off. Put that code in on checkout, and you'll have yourself 25% off. That will it's pretty much covers the cost of what we use to print the material. So we don't really make much off it. It's more to help our learners grow and really be able to contribute to patient care. That's why we do this, and we love doing it. So thank you so much for your support. If you have any questions, just leave them below, and we're happy to answer them. All right. Have a great day.